Hi guys, so today I'm going to talk about Cushing's disorder or Cushing's syndrome. It's called both. I have Cushing's and I'm going to talk about my experience with it. I'm also going to talk about, I have some information from the Mayo Clinic about sort of what it is and more in depth than what I would know as just a patient with it. Once again, this is not a medical video, it's a video just to inform about what Cushing's is. So what Cushing's is you overproduce the stress hormone cortisol, and by overproducing that, it affects pretty much every part of your body and can cause you to either develop other conditions, or if you have other conditions, it makes it a little bit more difficult to manage them. And I have some of the conditions before I had Cushing's. I had some of those conditions, and I'll talk about that. So what cortisol is the stress hormone. So the stress hormone gives you the ability to have your fight, flight, or freeze response, which obviously we need, because if we're put into a dangerous situation, our brain needs to be able to decide, are we gonna fight for ourselves, are we gonna run away, or are we so overcome by the stressor that we're just gonna freeze in place. So the brain needs to have the cortisol, but when you have too much cortisol, then you have Cushing's, and then you have certain symptoms and certain things that happen. So I was originally suspected of having Cushing's about 3.5 years ago, when I was going through the obstetrics clinic at one of the local hospitals when I was trying to get pregnant. And the conception internal medicine doctor that I was seeing, she was my main doctor there. She became my family doctor, and so she started doing a lot of different things for me. And over the course of the time that I worked with her, she made notice to the fact that I carry all of my weight here in my abdomen. If you measure my wrists, or you measure my ankles, my thighs, my upper arms, they're all within ratio, and if some of them are actually the lower end of ratio for an adult female. But when you look at how much weight I carry in my abdomen, I'm way over. If you do my BMI, I'm, I don't know, like morbidly obese plus. Because I carry a lot of weight around my stomach, that weight, it puts my physical weight up. So one day when she was examining me, she noticed that on the back of my neck, and I can't really show you, I don't think, I'll turn around and see if you guys can see the back of my neck, right around here, there's like a different color skin. Almost looks like light bruising. I have the same thing on the back of my knees. And she asked me about that, and I said, no, I never hurt myself. So she monitored it over a couple of months and realized that it's not going away. Like, it's not a bruise, it's just my skin. And that's one of the first things that she noticed, in combination with my weight and how I was exercising and I was eating well and I was doing all the things that she wanted me to do in preconception, but yet I still was struggling to lose weight. I was losing some weight, but I was struggling to lose weight. So what she did is got me to do a 24-hour urine test, which is so much fun. You have to gather all your urine, so you have to pee into like a bedpan at home, put it into this big container that has like a solution in it, keep it in a dark, cool place. You have to keep your urine for 24 hours. And when the 24 hours is up, you need to take it to the lab, and you need to have your cortisol level tested, and it needs to be done fairly quickly. At the same time, when you take your urine in, you get blood work done, and then I went and I did about a week after that, I did 6 times in one day. I had my blood work done, and what they were doing was testing my cortisone level. So first thing in the morning, halfway through the morning, noon, halfway through the afternoon, supper time, halfway through the evening, and then late at night. And then after that all came back, and it came back that my cortisol levels were higher than they should be. Then I had to get the saliva test done, which is where they actually gather your saliva first thing in the morning, and they gather your saliva late in the day, like into the evening. And if you have Cushing's, your cortisol level in your saliva will be lower in the morning and very high in the evening, and mine was. So then from there you go to an endocrinologist, and the endocrinologist figures out what your best course of action to treat it is. So what I was told was that I had to do 6 months of weight control, that she was able to track. So I had to work with an exercise specialist to come up with a home plan. And that's one of the reasons why I do the Chris and Heidi Powell shredder and shaper plan and the 9-minute missions, because they really work the whole entire body, and it's a home-based program. I also use their DVD series, Chris's DVD series, the beginner, intermediate, and advanced. I actually use it off YouTube. Once again, I can do that at home. And I do some water fitness when I can, because I love the water. And then I had to track with a dietitian every little thing that I was eating and try to make some tweaks. And because I have a lot of allergies, I don't eat a lot of bad food, but there was some tweaks to be made. So I had to do that, and then I had to go solid on that and weighing every week, and which is really hard with me with my anxiety, because I know I'm overweight. And the number scares the crap out of me. And then in the past I've went to the point of like not eating at all, which brought back symptoms of my drug-induced anorexia, because when I was using drugs, I was what they consider drug-induced anorexic. I was very, very small, but it was because of the drugs. And so when I stopped, I gained weight. And at first, that's why I thought I gained so much weight in my stomach, is because I stopped using drugs. So I just thought, okay, now I'm eating more food. The drugs aren't there to speed up my metabolism, because one of the drugs I used was crystal meth, which speeds up your metabolism. A lot of girls get hooked on it as an eating disorder. Sorry, not eating disorder, as a weight loss supplement, like a way to lose weight, and then they end up with an eating disorder because of it, and now they're addicted to a hard drug. And then that's a very typical story with crystal meth. So yeah, so that's why I thought I had the weight around my stomach, but that's not true. So anyways, yeah, so she tested me all, went to the endocrinologist. After the endocrinologist, did this for 6 months. Unfortunately, the 6 months was the first week of March of this year. That was kind of my 6-month mark, and I was going to be able to start my treatment, because they want me to do hormone treatment first before I do any drastic measures. And of course, as you guys know, I haven't been able to really exercise at all since the 13th of January when I had my car accident. And that's too long of a period of time to not be active enough, which drives me crazy, because now I have to do another 3 to 6 months of activity once I can get back to activity and eating well, which it is really hard, because the typical time that happens to a person is if they get like sick. Right, if they end up in the hospital, or they end up like with a really bad cold or pneumonia. And the crazy thing is November, December, and the beginning of January, I was fighting off a double lung pneumonia, and I was able to keep my exercise at the level that they needed. And then I get into a car accident, and then I wasn't, so it's frustrating, but it is what it is. We'll reset it and we'll start again. The other testing that I had done to verify once I got to the endocrinologist, they did a CAT scan of my head, because the pituitary glands are the glands that are affected, at least in my case. And so there's one in the front of your head and there's one in each of your kidneys. And so they're oversized, and they're like enlarged because they're producing too much hormone. And so that's what they do. They do a CAT scan, boom, yeah, it was there. Kidneys, ultrasound, boom, yeah, there. So that was the last deciding factor, or last diagnostic test to decide to make, yes, do have Cushing's. So now I have to wait to get back to exercise. I have to really tighten up on my diet to make sure I don't gain weight because of my inactivity while I'm waiting for my back to get good. I'm starting to be able to do a little bit of swimming, so that helps, but it's nowhere near the activity level that I was. So that's kind of my journey with Cushing's. So now what I'm going to do is I'm just going to briefly talk about what I got from the Mayo Clinic website and how these different areas have affected me, and make sure I haven't missed anything about my journey. So the common signs and symptoms are a large amount of weight held in either the abdomen, which is my case, the face, which they don't think, they just think like it's called moon face, so it's like round face. They don't think I have that though. Or in the lower back, or between the shoulder blades, and that one is called buffalo hump. I'm not sure what the lower back one is called, but the one that I mostly have is the stomach. I don't have the back ones, and my face is round, but I have my family history, like the traits in my family are round face, so it's very possible that it's just a trait that I have of having a round face, and then my double chin, not from being overweight. So, and then the other thing is skin changes. So like I explained at the beginning, my skin changes are the back of my neck and the back of my knees. So the next common one is pink or purple stretch marks, and I on my stomach, like usually stretch marks are kind of like white, and it's kind of like raised up or indented on your skin. Mine are actually purple. Some are pink, but mostly are purple. And that typically happens on the stomach, thighs, breasts, and arms. Where mine's most is the stomach and the right thigh. I have some as well. Thinning or fragile skin, meaning you bruise easily. I do bruise now. I don't bruise super easy, but I used to be able to smash into the wall and not bruise, and I bruise a lot easier than that now. Like a stub toe, I may break it or not, but my foot, not just the toe, my foot turns purple from a bruise. Slow healing of cuts, insect bites, and infection, and that's complicated by my diabetes, because diabetes makes you not be able to heal from infection as well. And I have found over the last probably 5 years, cuts take longer to heal. Insect bites are an interesting one because I'm allergic to flies and mosquitoes, so I get welts on my arm anyways. That's been since I was a little kid, so I don't know that they take longer to go down. They take a long time to go down just on their own, so I'm not really sure. And infections, yes, I have found myself on IV antibiotics for things I should have just been able to take oral antibiotics for. And then acne, and I do have acne on my chin and up the side of my face. That's really the only place, but I didn't even have that as a teenager, so That's definitely new, and that's probably in the last 5 years, I'd say. So for women specifically, thick or more visible body hair, especially facial hair. So I have to get my lip lasered, and as you can see, my eyebrows are thick as heck. I've had them thinned out so many times when I get them waxed. They need to be waxed now, but and it just keeps going back in thick. And with waxing, after a while, after getting it done, it shouldn't grow in at all, and mine come in back in very, very thick. So I have here, and then I have these 3 fingers of both hands, and I have my big toe and the toe beside it that all have hair, just like men, like they look like men's fingers and toes. And then irregular or absent menstrual cycles, and for me that gets complicated by my endometriosis and my polycystic ovarian syndrome, which I'm going to do separate videos on because they're very detailed, kind of confusing disorders in themselves. The regular, absolutely. Unfortunately, I haven't had the effect of absent, which I guess is a good thing. When I was going through the time of trying to get pregnant, it's a good thing that I wasn't having absent ones. But yeah, definitely irregular. And I'm actually going to do a whole video on, well, no, that will come out in the videos of the polycystic and endometriosis. So just quickly, what happens in men is they get a decreased libido, decreased fertility, and erectile dysfunction. So for them, it affects their reproductive system solely. They have the weight and all those different things, but of other areas of their body that's being affected, it is they're all connected to reproductive health. So other signs and symptoms are fatigue. Fatigue is hard for me to distinguish where that fatigue comes from. Is it Cushing's? Is it my low vitamin D? Is it my anemia? Is it my low thyroid? And I'll do separate videos on low vitamin D, anemia, and low thyroid. But I will say for my low thyroid, I've had all the 6 level testing done. If anyone knows anything about thyroid, a lot of people get misdiagnosed as not having low thyroid, because the doctor does the first 2 tests, they come back fine, and they don't dig further. There's actually 6 different levels that you want to test. That's all been done. I'm actually on thyroid medication. I'm anemic. I've been anemic since I was a teenager, and that's largely connected to my very heavy bleeding during cycles. And my vitamin D level, I think everyone has a bit of a low vitamin D level. I mean, I do get outside as much as I can, but I have a lot of seasonal, well, not just seasonal allergies in general, so sometimes it's a little bit hard. So fatigue is a symptom of all 4 of those things, so it's really hard to tell which is which. Muscle weakness, that's mostly in my legs, and that's kind of scary because MS runs in my, well, it doesn't run in my family, but there's people in my family that have MS. It scares me because my mother-in-law, which obviously she wouldn't, like, there's no bloodline there, but it just scares me because of her ALS. It just makes me, like, my husband's muscles are really weak from his arthritis. Like, it just scares me because I know way too many people that have way too many different things that muscle weakness can be a part of. Depression, anxiety, and irritability, that's complicated by my bipolar and anxiety. Loss of emotional control. I don't think that that's really been an issue for me, but part of that is because I do psychotherapy and EMDR for my bipolar and anxiety, so I had a handle on that, I think, before this started to happen with me. So I think that's where I don't think it's such a big deal, but it's definitely a symptom. Cognitive difficulties. I get brain fog, and that is contributed to my bipolar, but it could also be contributed to the Cushings. I haven't really seen a difference since we've been doing the testing and like thinking back, but I've always kind of had brain fog, so I'm not really sure. New or worsening high blood pressure. This could be a masked symptom for me, because about, I don't know, 5 years ago, maybe 4 years ago, I woke up one day with my head surrounded in blood, and I'm actually going to do a video on this as well, but I was diagnosed with chronic nosebleeds, and I had to get my nose cauterized a bunch of times, and they eventually put me on blood pressure medication because my blood pressure was high level normal. So they brought me down to low level normal, middle level normal, somewhere in there. And so by taking blood pressure medication for another disorder, I could very well be masking the fact that I have high blood pressure connected to the Cushing's, because I don't show high blood pressure, but I'm on blood pressure medication for a non-blood pressure reason. Glucose tolerance that may lead to diabetes. So I am diabetic. Polycystic ovarian syndrome is also, there's a component of insulin resistance there. So, and I have that as well, fully diagnosed. So it's definitely a complication of that. Headaches. I have trouble with migraines. I have since I was quite young, and I used to take medication every day that helped to prevent them. Now I stopped taking, like I've been on a couple different ones, but I stopped taking it a few years ago because it was doing nothing for my migraines. So I still get migraines. So could that be contributed? Maybe. The other thing is because of all my migraines, I can't think back of a time where I haven't had some pain in my head. Like every day I have pain in my head. Usually not enough to medicate, like the pain's not bad enough to medicate, but I don't remember a time, like a day where I woke up, oh, I don't have pain in my head, and I went through a whole day without pain in my head. Bone loss leading to fractures over time, that hasn't happened, thank goodness. So some of the other things that could be influencing it is cortisone steroid medications that you can take them for a bunch of different reasons, but I have taken them pretty much my whole life for asthma and for inflammatory bowel disease because I have colitis. So that in itself can cause you to get Cushing's with nothing else. So yeah, it affects the cortisone level in your body. And the glands that produce it is actually your adrenal glands, your pituitary gland, your thyroid gland, your parathyroid gland, your pancreas, and ovaries or testicles. So that's male and female specific. And if you look at my thyroid, well, my thyroid doesn't work enough. But could my thyroid be throwing out extra cortisol but not enough thyroid hormone? It's possible. So it's just another complication. And I already talked about the key role that it plays in our bodies. It does also help to control your blood pressure, and it does also help fats and carbohydrates break down in your body, and so it's an effect of your metabolism, which is why it's hard to lose weight. So I talked about the role of that steroid medications can play, so you can have to use that for lots of things. I use it for arthritis. You can use it for arthritis, lupus, MS, those type of things. I use it for colitis and asthma, and I have since I was very little. Been on like prednisone, having to do a prednisone run. That's been as long as I can remember. So that itself can cause your body to build up too much cortisol over time. And so if you take out the diabetes, the endometriosis, the polycystic, that everything else, you take out everything else that's going on with my body, and you just look at the asthma and the colitis and the medication I've had to take for that, that could be enough to cause Cushing's, because of how long I've been taking it, because I've been taking it pretty much my whole life. There's no known hereditary component to Cushing's. It's because it has to do with the cortisol level in your own body, and that's not something that's that goes from generation to generation, especially because so many of the medications you use can affect it. Other disorders that you get, now things like diabetes runs in families. So there are some disorders that could lead to Cushing's that do run in families, but Cushing itself has no hereditary component. If it's not properly treated, it can lead to osteoporosis, bone fracturing, rib fracturing, fractures in the feet are very common, high blood pressure, diabetes, frequent or unusual infections, and loss of muscle mass and strain. So those are some of the long-term things if it's not treated. It's difficult to diagnose, and it has to be diagnosed by an endocrinologist, which is the same type of doctor that diagnoses diabetes, because it's essentially an endocrinologist is a specialist that deals with diseases of the hormones. So yeah, your doctor can do a physical exam. So this is kind of how it's diagnosed. So look for looks like bruises, but they're not bruises, change in colors in skin. Look for the round face, the stomach fat, the back fats. Look for slow healing from being cut, slow healing from bruises, those sort of things. If they suspect it, they kind of do exactly what my doctor did. So the first thing is the 24-hour urine with the blood work. If that comes back, then typically at that point they refer you out to an endocrinologist, because it's a very specific thing. But they may send you for the saliva test. Some family doctors do a saliva test, and mine did. But she was in the hospital, so she was kind of connected to the clinic that did it. I don't know if like my current family doctor, I don't know if he'd be able to do send for a saliva test or not. It might have to be done by a specialist. So then a saliva test is the last thing that a family doctor would do if they can do it. Then you go to the endocrinologist, and the endocrinologist is going to look at like I was talking about, either pituitary glands or the adrenal glands. And they're going to either ultrasound or CAT scan those to see if they're enlarged. They're also going to look and see if there's anything underlying that could be causing the same symptoms as Cushing. So polycystic ovarian syndrome is one of the most common ones for females, and that's just an internal ultrasound. I've actually had mine eyes on because of my endometriosis and the surgeries I've had for that, and I'll talk about that in those videos. But you can diagnose it with blood work and internal ultrasound. Things like diabetes, things like high blood pressure, any of the things that you can get as a result of Cushing's, they want to rule out that you don't have in that moment, treat it and see if the Cushing's goes away. Because that would mean it's not truly Cushing's, it's actually those other disorders. Or you can be, in my case, and be complicated like I am with all my medical stuff, and have both Cushing's and the disorders. So what do? You try to reduce the use of steroid medication. So I've been switched from Ventolin to, I cannot remember what it's called, for my asthma as my rescue inhaler, because Ventolin is a steroid. I still take Advair, which is partially steroid, every day. I take it in the morning and the night for my asthma, and I've actually been able to control it, so that's good. I need to go to the doctor. I need to stay on top of my lungs and lung infections and stuff, so that I don't end up having to take prednisone for my lungs. When I had pneumonia in November or December, I had no other choice, or I would have been admitted to the hospital. but trying to get there to try to get an antibiotic and even add another a non-steroid puffer can help. So, and with my colitis, knock on wood, I don't take prednisone very often for that anymore. I used to a lot, because I also have a component of irritable bowel syndrome, which I'll talk about in my colitis video. But it was very complicated there for a while to know which was which. But now I kind of have my strict diet, well, somewhat strict diet, like strict. It's more what I can't eat, and then what I can eat, I have to figure out the best diet for myself with it. But I have that. So I did have to take it once last year. Prednisone, I had to take it for about 6 weeks. But I think before that was like, I think I've only ever done it one other time, maybe 2 other times since I've been in Alberta, and that's 8 years. So in 7 years I did it, I think 2 times, and then I did it once in the last year. So trying to reduce that as much as you possibly can. Hormone therapy, just what I'm going to be doing if I can ever get myself back to the right state. So with the medication, hormone therapy, you need to be on that strict diet, the strict workout. You need to work with professionals just so that the endocrinologist knows that everything is good. And then you can do hormones. So you don't want to completely get rid of cortisol, but you can help to bring it down. And they do that by adding other medication or other hormones, so helping to balance with the hormones. And also there's some other medications that they can use that help to keep the cortisol level from raising crazy and not and yeah, just going up when it shouldn't go up. Well, I'm not in any form of stressful situation, so why is it rising? So they have medications that aren't hormones that do that as well. Other things that can be done is you can get surgery to remove the pituitary or the android gland. Problem is if you do that, then you have to not only replace, you have to give back the cortisol, but the body doesn't know what to do with the cortisol, so then you still have to take the other medications to bring the cortisol level down. But then you bring the cortisol level down and you don't have the gland that's producing it, so then it goes too low, and then your fight or flight gets mixed up. It's a mess. So they don't like doing surgery, but I mean, if it has to be done, it has to be done. And the good thing with that one is people like, how would you get your, like, that's brain surgery. Like, that's the first thing I thought of. And they actually go up through your nose because the gland is right there in the front. And then the kidneys are done like laparoscopically. So that's not a big deal. And then some surgeons will do, or some doctors will do radiation therapy. Sometimes the tumor on the gland that's making it enlarge, that enlarged part, they can't get it all out, so then they'll do radiation, but it's radiation specifically on that gland. That is a little scary because if they didn't get it all from the one in the front of the head, that would be radiation on your brain. But I mean, it's a last ditch attempt, and really what they say is, or what my doctor told me is, if it ever got to that point, that the risk that I run by continuing to have Cushing's that isn't controlled is much higher than any issues that the radiation to that gland could cause my brain, as it's done in a safe way. And I mean, if we think it's 2015, I mean, we're not back in the 1900s, right? And then the kidneys would be the same thing. If none of the treatments are effective, then none of the treatments are effective at all, so none of that stuff, they would remove all of the glands that cause cortisol, and in that case you run a really high risk of not being able to respond properly in your life. And that's when it connects back to mental health. It connects back to like very much to your mental health, so you get very depressed, very withdrawn, very you're afraid to go out into situations because you might need to fight, flee, and hopefully you wouldn't freeze, but what will end up happening is you will freeze, because freeze out of fight, flight, or freeze is the only one that you can do without cortisol, because you just tense up, you just have an anxiety attack, you're just trapped in your body, which I've experienced, which isn't fun with my anxiety. So that's the risk that you run if you do not, if they can't do anything other than remove all the glands. So some of the things that you really need to do is you need to really be on top of what you eat. You really need to be on top of your activity, which I've talked about. You need to get your calcium and vitamin D levels checked on a regular basis, because that's what keeps your bones strong, and that's what's going to prevent you from getting osteoporosis. I get my vitamin D level checked every 60 days, I think. Yeah, 60 days. And I take my multivitamin, has calcium. I can't really stomach calcium pills, and I can't drink milk. So I have to get calcium fortified, like soy milk or almond milk, and just be on top of the calcium. Try to eat foods that are high in calcium, so dark green vegetables, that sort of thing, which I eat a lot of. So my calcium level is not so bad, but the vitamin D helps you absorb the calcium. So citrus also helps, because that has the vitamin D, like oranges or tangerines or whatever. So if you can eat that with something that's calcium. So I've come up with some pretty interesting creations for salads to put the two together, because you need to eat them together. Monitor your mental health, because like I said, depression is a definite side effect of Cushing's, uncontrolled Cushing's, so not being treated Cushing's. It's a side effect if you get any treatment. It's a side effect if you have to get the full treatment. I'm very lucky that I have a psychologist that I see every 3 to 5 weeks, kind of whatever fits into the schedule, so about once a month, let's say. I have a psychiatrist that I only see every 6 months, but I can see more often. I don't know if it would be him. They might have to change me to a different one, because he's only a consulting psychiatrist at the clinic I go to, but I have the access to it. And I also have a family doctor who is quite young. He's actually younger than I am, and he's very up on mental health. So there's some stuff that he won't do because he's afraid, you know, like that's not his specialty. But like he'll prescribe medication, he tries to understand disorders, and I was the first patient he had with bipolar in his family practice. So he actually has done some extra, not his training per se, but like reading up and stuff on bipolar, because then when he sees me, that's another level of protection of, okay, is she showing mania, is she showing severe depression, whatever. And I'll talk more about that in my bipolar video, because my bipolar is brittle, which is a whole other kettle of fish. And then for your muscles, which is something, got to say, that's something that doesn't go away even if it's treated and you're on the medication and you're good. You're always going to have issues with your muscles, so you want to try to stop them from becoming something more progressive. So you know, doing hot baths, doing massage, doing low impact exercise when you're doing your exercises, so water aerobics, do tai chi, yoga, work with an exercise specialist around what exercise you should be doing, which is what I did when I developed to do the Chris and Heidi PAL program. It was seen as, it's not too hard on my joints, it's not too hard on my muscles, but if I do start getting a extra muscle pain from it, then I have someone who specializes in exercise as a kinesiologist who can adjust it for me. So that's very important to have. And the other thing that's very important to do is to exercise the brain. I don't have, like I said, I don't have any effects that I know of from like cognitive impairment. My IQ, they actually got me to test my IQ, and luckily I tested it before, because my husband actually has a very high IQ, and he actually can go into Mensa, which is like for people with higher IQs. So I had done my IQ probably 5-6 years ago, and I had that actually saved. It was just kind of remarkable that it worked that way. Then I did it again, and my IQ actually went up 3 points. And it's not a perfect system because every IQ test isn't the same, even though I did take the same one or the same company. Like everyone measures your brain your IQ a little different. So like a difference of up to 8 points is normal. But mine actually went up a little bit. So, okay. So it's not affecting, but to do things like those math puzzles, Sudoku or whatever it's called, word searches, crosswords, you know, any brain games, right? That's very important to try to warn off that cognitive impairment. And really, let's be honest, if we started at a young age, like if I started now, it's going to help me as I age. And that's like, for instance, why my grandmother is still so cognitively sound at her age, and her video is actually coming up very soon on my to-do list. But her body is completely failing. She's completely frail, but her brain, last time she was assessed, was like 35 years younger than her actual physical age. So I mean, it's good to keep your brain active and good anyways. But yeah, so that's a pretty freaking long video, 42 minutes, and I apologize for that, but I wanted to try to explain some of the other things that come with Cushing's that I might not have experienced, and also the different types of treatment, because I'm kind of set on the hormone treatment is what we're going to do, and we're not going to do any of the intervention. The only intervention that they might do is the nose surgery for this one, because this one has the bigger tumor. My kidneys have it, but not as big, so they might do that one. So I knew about that surgery, but I didn't know about some of the other stuff that I read from the Mayo Clinic website. So that's that. If you have any questions, please, excuse me, leave them below. I'll answer anything I can. Once again, I'm not a medical professional. I'm just someone who experiences Cushing's, so I can't answer any medical specific questions, but I can answer, I'll try to answer whatever I can. And if not, I have a lot of great resources for Cushing's, because when I was first diagnosed, or when they thought I had it even before I went to the endocrinologist, I was really scared. And my anxiety kind of took over, so luckily my doctor gave me a lot of good resources, online resources and stuff about it, so I can link those to you and let you guys know about them so you can check them out yourself. So anyways, that is that. I hope you learned something. If you like the video, please give it a thumbs up. Please subscribe to my channel, and I will keep you guys up to date on what is going on with my Cushing's treatment. Have a great day, guys. Bye bye.